Since we last spoke, the FDA and CDC have approved the Pfizer vaccine for children ages 6 months to 4 years old. Since we began administering this vaccine in late June, we've given almost 1,000 doses to our pediatric and through our pediatric and family medicine clinics. Parents and guardians looking to get their child vaccinated should certainly discuss that with their pediatricians and call and schedule an appointment. What we saw was an initial rush of parents who were very anxious to get their children vaccinated. And I think those parents have real reasons to want to do that. So, if you're a parent of a child who was a preemie, or you're a parent of a child that has a chronic medical issue or takes a medication that can suppress the immune system, or you're the parent of a child, and the child lives in a home with maybe an older person who's got health problems or problems with their immune system, you've been very anxious and waiting to get your child vaccinated because you want to maximize their protection. Maybe you're a mom who had trouble conceiving, and now you have a baby. And so these are very emotional and hard decisions for parents to make. So I think what we saw is, like in most places in the country, vaccine is available, and the most eager parents to get their children vaccinated have done that. And then you have kind of the next wave where you have parents who maybe your kid has already had COVID. Maybe you want to see how it plays out a little bit more. Maybe you don't have all of those risk factors, and so you want to wait a bit. And we've seen that as well. And so I think, these are decisions parents have to make with their pediatrician. They have to look at the data around vaccines and decide, what their decisions are going to be around COVID vaccine. They've been incredibly safe, and so we continue to talk about that. And I think at some stage they may get incorporated into child vaccination schedules on a more formal basis, but I think that would come, at a later date.